to me when I was having another symposium, and he came to share a testimony because he was looking for a child. It's not that he doesn't have a child, he has a child, but for 5 years, the second child never came. Upon using the product, the wife got pregnant. He used the product together with the wife. In 3 months, the wife got pregnant and delivered a live baby. So we now have a super live baby in my team. The testimony of the wife boosted the morale of Osman, who was also looking for a child. And so Osman too now has his child because his wife too was also looking for a second child. And I don't know what is happening in my team. We now have a third super live baby in my team by an immigration officer I recruited when I was crossing the border from Ghana to Togo. And he wanted to know if I could help him, and he shared with me that he was also looking for a child, and I introduced SCC30 to him. 9 months down the line, this man's wife has delivered. And I have a man in Ghana who suffered from an eye condition called pterygium. And this is an eye condition that can only be resolved by operation. Now, I showed you one of the properties of stem cells, and that is clearing of dead cells or replacing dead cells. And miraculously, without surgery, this man now has a clear eye without surgery. So these are some of the testimonies we've shared so far, and I want to thank Dr. Maha for this opportunity. I will end here later on Tuesday or Friday when I have the opportunity. I'll share more testimonies. My presentation is over. God bless us all. Victory Namake, Victory Nicham.
All right. Thank you, Dr. Ofori. That is Dr. Ofori for y'all guys. You see, some of you asking whether we have recorded a session. Yes, the entire session is recorded. And then, you see, because we want y'all to understand the whole, how our health path is working, guys. We are focusing, as what Dr. Siva rightly started off, that our immunity is very important, and our immunity is our first doctor. Our immunity is our natural doctor within us. You must take care of that immunity, and that is very important. Okay, so now I'm going to open up for questions further on from those people who left on from there, and you can ask questions now, and after that you all also can share how you all felt the whole this thing. We are going to have symposium like this on health, like the one we had was about 2 months back, and now we are having one, and then this will be there because we want to support the community of us who are with us now. It's not just for ordinary people who come newly. It's also for us. We are all as members. As members, we have bought something with us, and we need to understand what we have to take care of our own health. My health is my wealth, and my wealth is my family's health, guys. So today is more on health-wise focus. Okay. If you are going to come and want to know, some people came and asked me, what about the income part? That is not today. That is on every Tuesdays we have, and then every Fridays, okay? So thank you for Dr. Siva and Dr. Ofori for such a wonderful presentation. Guys, there is a recording done, okay? So I'll pass to you. Now I'm going to open up for the floor for the questions. So I have few people here. Ms. Teresa B. Ms. Teresa, can you unmute yourself and your name and where you're from? Hello, Ms. Teresa, are you there? Hello? Okay, I'm going to mute her first, then I get the next person, Mr. Ansa Dominic. Okay, if you're still there, can you now share? Hello? Yes, Mr. Ansa.
Okay. Hello.
Hello, yes.
Yeah, good afternoon. Please, I'm Ansa Dominic, I'm from Ghana.
All right.
Yes, please, I would like to know whether taking any of our products dependent on the blood group type.
Depending on the blood group.
Maybe does it affect? Yes.
Okay.
Yeah.
All right.
Yes.
Okay.
Sometimes. Okay.
All right. So I can also ask Dr. Siva to share on this question. Taking our products, does it need to go on specific blood group type, or anyone can take it, Dr. Siva?
I think it doesn't matter what blood group you belong to.
Yes.
Everyone can take this product, and it will work just as well. Okay.
All right. Okay. Thank you, Dr. Siva. So you see, as what Dr. Siva said, blood group doesn't matter. Anyone can take it. It's just like taking fruits, guys. You're taking fruits at the source level. That's all. Okay. So I'm going to get All right, let me see the other persons who put up their hands earlier. Okay. Okay, and let me see here. Okay, I don't have a name here. There's a Galaxy J4. Okay, I'm going to unmute you. Just introduce yourself. Next time you can rename yourself so that we know your name. All right. Galaxy J4, you can unmute. Okay, then I can ask the question. Are you there? Galaxy J4? Okay.
Hello.
Yes, sir.
Hello.
Where are you from?
I'm from Greece.
Greece.
I'm
okay.
calling from Greece.
Yes, sir. Your name?
My name is Joseph.
Joseph.
I just want to ask a question about. I've heard you giving an answer to some of just like a question that I want to ask. Somebody that is under a medication, like somebody that has a atrial fibrillation, which is called a arrhythmia, and is taking a medication, and because it's like the SCC15 is also helping the blood to flow in the vein, and the medication that the person is taking is almost the same thing, doing almost the same thing to make the blood to be the normal rate that it's supposed to be. So I just want to know if the way you explain it, after taking the FC30 in the morning, so I should go ahead and take the medication in the afternoon, after 2 hours, as you said.
Yeah, that's been answered by both Dr. Siva and Dr. Ofori also. Yes. Okay, you give them gap so that it doesn't clash with each other, so it can do their job well. All right. Okay.
All right.
So all right.
Thank you very much.
Most welcome. Okay, so your question been answered. All right, I'm going to get the other person here. Daniel, okay, Fatima first. Fatima puts her hands up first. Fatima Yusuf. Go ahead, Fatima Yusuf. You can unmute yourself.
Superlife.
Life is super. Yes. Where are you from, Fatima?
I'm from Nigeria.
All right, go ahead.
I want to ask about a sickle cell child of about 9 years. What's the quantity the child is supposed to take?
Okay.
And also a child of like 12 years that has hepatitis, what's actually the quantity that child is supposed to take as well?
All right. Okay. So since it's a medical related question, I have the answer, but I would like Dr. Ofori to answer because sickle cells is related to Africans. Then maybe Dr. Ofori, you can answer this question now.
Dr. Mara, please, I want to mute my video. I'll answer it. I want to remove my suit, so I'll answer whilst.
Okay, no problem.
So, I hear from Nigeria, yes, the product, I've been doing some little research about it as to the doses for children and adults. Apparently, the studies indicate that there's no significant difference if you take one sachet, because the 1,500 milligrams are food nutrients that you are giving into the body. So ideally, it is recommended that you take a sachet a day. Okay. Whether it's a child or an adult, you can take a sachet a day. Thank you.
All right. Okay, so you can take a sachet a day to take care of that. Okay, a sachet will help you. And I'm going to call Miss Mercy from earlier. I wanted her to speak, but I couldn't get her. But she's put her hands up, so maybe she asked me to ask a question or what. Okay, Miss Mercy, go ahead.
Yes, hello.
Yes, Miss Mercy.
Morning.
Good morning to you.
My name is Essie, and I'm calling on behalf of my mom, or I'm asking the question on behalf of my mom, who has had surgery, cervical disc replacement by her in her back. I think the upper neck area. She did that about 3 years ago, and also from time to time she gets injection in her lower back. For nerve problems, and since then, I would say about 3 years ago, she's basically been on disability. She's been home. She hasn't been herself, and even after the surgery, she's still not 100%. So I was just trying to ask which of the medicine or the supplements you guys provide will assist or help her in maybe in strengthening or maybe recovery, renewing her nerves or something. I don't know, but like basically help her out.
All right. Okay. You can mute yourself, and I'm going to get now a lady who had issues, very chronic issues, and she has taken our product SCC30, just SCC30, and she has recovered. Maybe it's the time for her testimony, and after that testimony, then I will get the doctors to answer all these other questions also, okay, including your question. But let me get Miss Lucy from UK. She's a person who is a walking miracle because of SCC30. And guys, in YouTube, I have a video just on the miracle, just on the testimonies of the products of 4 or 5 people who use this product and how it has helped them. You can go into my YouTube, Dr. Maha, you can get that. And then I will try to sit down today and upload all this video and another video I promised you all. And you can get all these videos there, all right? So now I'm going to call Miss Lucy from UK to share live testimony, okay? How our product SCC30 is helped. So most of these questions will be answered by her. Go ahead, Miss Lucy.
Okay, thank you very much, Dr. Maha. It's a privilege to share again about my testimony with regards to SCC30. As we are all aware, SCC30 is taken sublingually, meaning you put it under your tongue.
Yes.
And when people ask me a lot, Lucy, how exactly did you take it? Because I've been taking and I'm not having a testimony. So I tell them that a lot of the time, because we put it under our tongue, saliva tends to come quickly into our mouths. And what some people do is immediately they swallow the saliva with the SCC30, which means that the SCC30 gets into the stomach. And as Dr. Ofori said, when it gets to the stomach, the bioavailability of it is very low. So when you put it under your tongue, you have to wait. And I say to people 10 minutes, because sometimes, because it's a powder, there will still be a few ones when you take it and it's not up to 10 minutes yet. And one other thing too is the water intake. I usually say, people say, oh, well, I can't drink a lot of water. I can't drink a lot of water either, but I still manage to be able to drink the 2 to 3 liters of water in a day because I'm not on any fluid restriction. How did I do that? When you take a bottle of water like this much, if you want to be able to drink maybe 200 mils or 100 mils at a time, it might be difficult, because if you have problems like reflux, which I had, you can vomit everything straight back up within 30 minutes of taking this water. So what I chose to do was I will be taking sips of water consciously, not waiting until I'm thirsty before I take the water. So I was taking within an hour, I'll manage to take about 4 or 5 mouthfuls of water. In that sense, before you realize, by the end of the day, you might have even drunk more than the 2 liters of water. Now, going back to my own testimony, I've had severe asthma since my childhood and a lot of complications, including spine issues and things like that. I was in a wheelchair for over 4 years. I became bed-bound because all my organs there was a lot of compromising effects from the medication and from how the condition affected me as well. So it got to a point I couldn't even get out of bed, and I had to be hoisted out of bed because I've got a special recliner chair. I couldn't sit for more than half an hour at a time due to the nature of the spine issue I had. I had a curvature in my spine, which was compressing on the nerves. So what happens when I sat down was, when I sit down for more than half an hour, especially upright like this, the spine will be compressing the nerves. Hence, my limbs, my lower limbs, which is my legs, will start becoming numb because I had cord compression due to the L4, L5 area where the curvature was. When I started taking SCC30, the sensation that I didn't have in my foot, and from my asthma treatment, I developed type 2 diabetes. And not only that, I had neuropathy as well, meaning that when I'm able to weight bear. When I weight bear, it feels like stepping on broken bottles, and it really hurts. I was on a lot of pain medications, morphine patches, morphine slow release tablets, and all. But thank God for SCC30. Now I'm off all those pain medications, and my spine problem did not, because they were measuring my height to see whether the curvature is increasing or not. At a point, I was wearing a corset, which they stopped me from wearing because it was also restricting my lungs. And as I said before, I have severe asthma, so the last thing I need is a constricted lung. But taking this SCC30 has helped improve a lot of things in my life, that I'm not having all that pain any longer. I'm off all the pain meds. My blood sugars are doing very well, that they even wrote to me that I don't need to be checking them regularly anymore. So SCC30 does help with multiple conditions. Thank you.
That is Lucy. Lucy is living evidence, like how SCC30 helps. So to those of you who are new here, if you're asking a question, which product you should take first, it is actually always SCC30. It's a foundation for your health, guys. SCC30, if you're not having any sickness, and that is a product that you must take for prevention. And as like what Dr. Siva was mentioning, it's a complete food for your cells. It's a complete food for your cells. Whatever your cells needs for the day, it has got everything there. So that is why our focus is on prevention. Our focus is on wellness. Okay, why pay more for sickness when I can pay less for wellness? So if you take care of your wellness now, then you do not have to worry when your sickness hits you, because it's all taken care. So that is what our focus is. And Dr. Siva, he mentioned again, in terms of exercise, you need to do that. In terms of other angles, you need to do that, okay? So that is how the product can help you guys. And then, so I've got some more questions here I'm going to ask, because few people have put a question before we end the session shortly. So I'm going to give them time to ask question also, okay? Make sure it's related to what you listen now, okay? Do not ask any other questions there. So because I don't want to take up time from other people also who want to ask questions, guys, okay? So Lucy has got some questions to ask, okay? So I'm going to ask her to ask question, Lucy. Okay, go ahead, Lucy, you ask a question. I'll meet you. Go ahead.
Okay, thank you very much, Dr. Maha. I have 2 questions. With regards to our products, since all of them are taken orally, meaning by mouth, is it suitable for people who cannot be fed by mouth, so they are nil by mouth? They only are fed through either a tube through their nose or a tube through their stomach, which is NG or PEG. Can SCC30 be administered to these people? And the second question is, as SNC is a powder and is taken orally, when Dr. Ofori was speaking, he did say that you can either put it on your tongue or you can mix it in water and drink. I would like to say that because it's a powder, the risk of choking can be high if you just put it on your tongue. So if you're mixing it in water, how much water is required to dissolve the SNC before taking it? Thank you.
All right. SIC and SNC, the dissolving is about 200 ml of water. 200 ml of water will do for you to put it and then for you to stir it. And in fact, when the product came out, and that is what even the people through whom we got the products, they advised us, it should be 200 ml of water. Okay, so that will answer your question. 200 ml water is just good enough for even SIC and SNC. STC30, you need to put under the tongue for sublingual effect. Like what Dr. Ofori helped us the other day, somebody asked the same question you're asking, and I just want to correlate that to you. You just have to, this is only for cases where they cannot put under the tongue. Only for that, when we just mix it a little bit of water and then they can take it orally, because this is only for people who cannot take it under the tongue. Otherwise, it's always recommended sublingually because it'll work better. It goes directly into your system faster. Okay, so that is that. I hope you answered your question, Lucy, and then when Dr. Ofori is speaking, then he'll also cover on that. Okay, and then I'm going to ask a few more people here. Okay, so one person here, let me see. Okay, guys, this is a time for you to ask any questions you want, because today is a time for health-wise, okay? So for you to become wiser in terms of health and take care of your health. I have Mrs. Karema. Mrs. Karema, just your name and where you're from, Mrs. Karema. Where you're from, your sponsor's name and where you're from.
Superlife.
Life is super.
My name is Mrs. Karema. I'm from Germany.
Okay, yes.
I want to ask two questions. Number one question is a man of 60 years old. He wants to buy this product from me, and he wants to know if this product is very good. He's having what they call hernia. I believe Dr. Furi will know it, hernia, under close to his vagina area, and it's making him to urinate often, like he can urinate in the space of 2 hours 6 times. He's urinating often. He wants to know if this product will be good for him because he's also diabetic also. Then the second question I'm having a lady that wants to buy this product. She has been married for a while, and she has had 3 miscarriages, and she has negative blood group B, negative rhesus B, and she doesn't know if that is the reason why she's always having still abortion or that mixed abortion. Dr. Foro also we understand she don't know why it always happens to her when she's pregnant, and she wants to know if SCC15 can also work for her. This is my question. Thank you very much.
All right. Okay. So that's the question. Dr. Ofori, maybe you can answer the question because she mentioned. Dr. Ofori, are there?
Yeah, thank you for the question. I would like to address the hernia question first. You know, hernia is a surgical condition, so it has to be dealt with by doctors in surgery. So trying to say that you want to use a medicine to treat something that hernia is mechanical, it needs to be pushed into where each space enclosed so that it doesn't come out. There's a pouch or an opening that an organ coming out through there. So we have different forms of it. We have umbilical hernia, para-umbilical hernia, inguinal hernia, and all those things. So I would entreat that he seeks clinical care for that. After that, if you want to take SCC30, because of the vitamin C component in SCC30, it helps with connective tissues regeneration to intensify the muscles so that the space, the holes that are made for the organs to pass through are now strengthened. So that is for the first question. For the second lady who is having miscarriages, pregnancy comes with 2 components. It can be a male factor or a female factor. Probably the woman is rejecting the man's sperm. So when pregnancy is conceived, if it starts growing, the baby has to attach itself to something called decidua basale. So if the attachment is not strong, then the baby will come out. And if it happens within the first trimester, it's miscarriage. So ideally, you can take SCC30, but we need to know the cause of it. And I would prefer that if the woman wants to take the product, she should take it alongside with the husband. Both of them should be taking the same product. When the woman gets pregnant, then he should stop taking the product. That would be my answer. Thank you very much. God bless you.
Okay, thank you, Dr. Ofori. You see, balance must be there, guys. Both must be balanced. One is not, you see, our product is all about balancing our system. Always remember, what I love about SCC30 is using a very ancient method that has been prescribed by Ayurveda, which means wisdom of life, which comes from India, 5,000 years old, and then Siddha. Both these concepts are focusing on balancing our system. So SCC30 does that very well, and when our cells are balanced, our cells will be happy. When cells are happy, tissues will be happy. When tissues are happy, our organs will be happy. Okay, so in this case, we both husband and wife need to conceive in the right time, then both of them must be happy. So that is very important, all right? So Dr. Ofori has answered the question. Hajia Fatima, where are you from, Mr. Hajia Fatima? You can ask a question now.
Hello?
Hello, yes.
Hello, I'm Fatima from Kaduna, Nigeria.
Okay, go ahead.